everyone, I'm Lisa.
And I'm Seth.
And together we are
PD-Connect. Thanks so much for joining us. We've got our guest speaker here today. You're at the PD-Connect speaker series. We teach exercise and education for people with Parkinson's, and we're thrilled to have you all here. So here is our bio for Dr. David Spiegel.
Yep. Today's topic is bridging mind and motion with Dr.
I can't wait. This is great.
Okay.
All right. Dr. David Spiegel is Willson professor and associate chair of psychiatry and behavioral sciences, director of the Center of Stress and Health, and medical director of the Center for Integrative Medicine at Stanford University School of Medicine, where he's been a member of the academic faculty since 1975. Wow, that's amazing. And was chair of the Stanford University Faculty Senate from 2010 to 2011. Dr. Spiegel has more than 40 years of clinical and research experience studying psycho-oncology, stress and health, pain control, hypnosis, and conducting randomized clinical trials involving psychotherapy for cancer patients. Now listen to this part. This is the most amazing part. He has published 13 books, 13 books, 404 scientific journal articles.
Wow.
And this is our favorite, and 170 book chapters.
170 book chapters.
We were trying to remember how many it was in class today, but
17.
No, that's a lot.
That's
anyway,
a lot.
And research has been supported by the National Institute of Mental Health and National Cancer Institute, and more. He is the founder of Reveri, a pioneering self-hypnosis app, which makes the benefits of hypnosis accessible to all. Thank you so much for being here.
Thank you. All right.
Well, I'm very happy to be here. Thank you for having me, and delighted to see old friends here like Bob Hales. You get to a point in life where your introductions begin to sound like your memorial service, but I'm glad I'm still able to do what I'm doing. And let's see here. So I'm delighted. I was delighted to learn about the work you're doing. I saw some of the videos of you doing your physical workouts. I think they're terrific, and I'm glad to see it. And so I'd like to share with you what we've learned about bridging mind and motion and self-hypnosis, and how it perhaps can be of help to you. And I will start the slide. Can you see the slides? I have in the past gone halfway into my talk before I realized that I hadn't turned the slides on yet, so I'm very glad that. So I'll talk about a drug-free solution to helping people deal with mind and motion. That hypnosis is an opportunity to try out being different in a hurry and see what it feels like. And by the way, I'll be monitoring the chat if I can, and if you have any questions, feel free to raise your hand, and I'll try and incorporate them, but I'll leave time for discussion at the end as well. Talk about how hypnosis works on the brain, how it may actually modulate some Parkinson's symptoms, and I'll show you an example. Hypnosis managing stress and anxiety, controlling pain, and then I'll talk about the app. I do have a disclosure. I'm co-founder of Reveri Health, digital interactive hypnosis. It's available at the Google Play Store and the App Store, and also downloadable through our website, www.reveri.com. And I'll talk more about that at the end, but it's a way of having my mellifluous voice available whenever you need it. Lord knows there's enough stress in the world, and it seems to keep getting worse day by day. But the way we manage stress is crucial in dealing with its potential to disrupt our work, our sense of well-being, change in physical abilities, financial problems, changes in the social and, unfortunately, political environments as well. So stress are things we're going to have to deal with, and finding ways to deal with them better is a good thing. Now, there's a long history to hypnosis. It's actually the oldest Western conception of a psychotherapy. It's the first time a talking interaction was thought to have therapeutic potential. You know the word mesmerized. It comes from Franz Anton Mesmer, who was a Viennese physician, who thought that hypnosis worked by altering magnetic fields in your body. He probably was wrong about that, but he would induce these rather dramatic changes in people, that they would get near these barrels that were filled with iron filings. And he thought that getting patients near to it would change the flow of magnetic fields in their body. And suddenly people would have to show dramatic changes. They would look like they were fainting or passing out, or they would change their state of consciousness. And many of them actually seemed to get better. Mesmer was doing so well doing this in Vienna that he left his wife and family there and moved to Paris, where he competed very successfully with the leading French physicians of the day. If you think about it, if in a randomized trial you went to either see Mesmer doing this or a French doctor, you were probably a lot better off going to Mesmer, because the major treatment in France at the time was bloodletting. France was the world's leading exporter of leeches. Voltaire wrote to his brother when their father was dying, we did everything we could to save father's life. We even sent the doctors away. So Mesmer was very successful and popular, and it led to a kind of rebellion among the leading French physicians. This is an original copy of the report of an academy that was convened by King Louis to investigate Mesmer. And they concluded that hypnosis was nothing but heated imagination, which is probably true, actually, and that's a good thing, but it wasn't considered good then. You'll notice that among the members of the academy was Mr. Franklin, that was Benjamin Franklin, who was having a good time in Paris. Lavoisier, the brilliant French chemist who developed the principles of oxygen chemistry, and shortly before he died, developed the concept of the gross national product. So he was a leading figure in both chemistry and economics. He was beheaded in the French Revolution. And one of the other members of this academy was Dr. Guillotin, the inventor of the guillotine. He kind of created the mind-body problem. And so it was a strange story. It was a strange dismissal of a very useful technique. And it was the first of many rejections. But also the interesting thing is that hypnosis simply hasn't gone away because it's too interesting and too important. James Esdale was a Scottish physician who went to India and was using hypnosis as general anesthesia for surgery. It was much more effective than what they used to do, which was hold people down and get them drunk. And about 10 years later, when ether was introduced at the Mass General Hospital in Boston, the surgeon strode to the front of the amphitheater and said, "Gentlemen, this is no humbug," to distinguish what they'd done with ether with what Esdale had done with hypnosis. Esdale withdrew his finding because he said, "You're getting 90% surgical anesthesia, I'm only getting 80%. And it's taken us a couple hundred years to rediscover that the brain has something to do with pain control. And so I want to show you what that is and how the hypnosis, they used to call it animal magnetism. This is one way of referring to it, but not the best. So hypnosis and this animal magnetism is really a change in mental state that involves three things. It involves absorption. How many of you have gotten so caught up in a good movie that you kind of forget you're watching the movie and enter the imagined world? Raise hands if you have. It's a state of intense absorption. You become part of the movie rather than part of the audience. And this capacity to focus attention, like looking through a telephoto lens in a camera, is something that can allow you to accomplish some interesting changes in your mind and in your body. To do that, you have to put outside of conscious awareness things that would ordinarily be in consciousness. Right now, for example, you have sensations in your bodies touching the chairs you're sitting in. Hopefully that was not foremost in your mind until I mentioned it. If it was, we could just stop now. But typically, the more intently you're focused on one thing, the more dissociated you are from other things, including physical sensations. So feelings that are obviously available to your consciousness are not necessarily in your consciousness. And that is a potential advantage in using a technique like hypnosis. The third is the thing that scares people the most about hypnosis, suggestibility, the idea that somebody can make you do anything they want. It really is cognitive flexibility. And we've done research that shows that hypnosis, I think we have that. No, I'll get to that in a minute. Hypnosis can help you give up one mental set and switch to another more easily. And that is a tremendous therapeutic opportunity. And I'll talk about that as well. This is Bode Miller at the Sochi Olympics. That bastard Putin, among other things, insisted that the Olympics be at a place that had very little snow. So the team could only do one practice run before they had to compete. So Miller and others would go up to the top of the run, look up, close their eyes, and imagine every move they were going to make. A state of what I would call self-hypnosis. And they did extremely well in the Olympics doing that. So hypnosis involves this intensity of focus that you get when you're skiing or competing, coupled with dissociation, putting outside of conscious awareness things that would ordinarily be in consciousness, and what used to be called suggestibility, and we're now calling cognitive flexibility. We know that using functional magnetic resonance imaging, that people who are more hypnotizable have more coordination, that is functional connectivity between the executive control network up here, the dorsolateral prefrontal cortex, and the dorsal anterior cingulate. That's part of what we call the salience network. It's the alarm system in your brain, like the alarm system in your house. And when a pattern doesn't match, it goes off. So if you hear a loud noise and you suddenly get distracted, that's your salience network saying, there may be a danger out there, pay attention. If you coordinate what you're thinking about with the system that says maybe you should be thinking about something else, you can focus more intently. And people who are more hypnotizable can do that. So one of the things we've proven is that when you go into a hypnotic state, you turn down activity in the dorsal anterior cingulate, the part with the little yellow circle around here. And this shows that the more hypnotized people thought they were, the less activity there was in that region. So you're basically turning off your alarm system and saying, I'm just going to allow myself to get immersed in something else. And interestingly enough, also, and this is, one of the things that has frustrated me for a long time, is that so little use has been made of hypnosis compared to medications for problems like anxiety and pain. Now, they are useful. I'm a physician. I prescribe meds. But the same medications that help with pain and anxiety also are habit forming and can be dangerous. And last year, 88,000 Americans died of opioid overdoses in the United States. And in comparison, hypnosis has never succeeded in killing anybody. It just doesn't. So getting a balance between the kinds of interventions that people can use to help themselves that don't have those dangers compared to the potential benefits but dangers of medications is something we really need to think about, and how we help people deal with a variety of illnesses, including Parkinson's and anxiety disorders and insomnia and a lot of other things. What this shows is that in that dorsal anterior cingulate cortex, the more hypnotizable people are, the more binding there is of GABA, gamma-aminobutyric acid. It's the major inhibitory neurotransmitter, and it's the substance that is stimulated to bind by anti-anxiety drugs like alprazolam, Xanax, and others. So you have your own little pharmacy in your brain, and if you use your brain right, we also have endogenous opioids in our brain. And so we can learn to stimulate activity by the same pathways that medications use. Now, there are two other things that go on in hypnosis in the brain. One of them is higher functional connectivity between the prefrontal cortex and the insula. That's Latin for island. It's a little island of tissue in the middle of the frontal cortex. And it's a major mind-body conduit. It helps the brain control the body, and it also transmits information about the body to the brain. We call that interoception, the capacity to understand what's going on in your brain. The other thing that happens, the dissociative component, is inverse connectivity. So when you're using your executive control network in the front part of your brain, you're turning off the posterior cingulate cortex. That's a part of the brain called the default mode network, where when you're just reflecting on who you are, what you're supposed to be, what people think of you, it's kind of your superego in the brain. That's the part that's doing it. And the thing that happens in hypnosis is that to the extent you're engaged in hypnosis, you're turning off activity in that part of the brain. So you're not worried about who you should be or what you have been. You can try out being different. And that's one of the coolest things about hypnosis is you can just see what it would be like to be different. And Fiek Fairman, who's a postdoc in my lab, took the lead on this study where we found that to the extent that people are more hypnotizable, they are better at set shifting. They're better at changing the way they, if there's a new paradigm to solve a problem, they'll get onto it quicker. And it's the same ability to let go of your old preconceptions and try out being different. So what I'd like to show you now is something that surprised me and may surprise you. Our neurosurgery program implants electrodes in some patients, and some of you may have had electrode implantation for Parkinson's disease. You have to remain conscious because they have to make sure that they've got the electrode exactly localized in the right place. And the neurosurgeon called me up and said, you got to fix this guy, because halfway through the procedure, he said he couldn't lie there and take it anymore. And we had to stop and close up. And I don't want this to happen again. So get him ready for the surgery. So I saw him with the idea of just preparing him to deal with the anxiety and tension that comes with a couple of hours of neurosurgeons poking around in your head. Dr. Haidt said, please take care of him. So let me make sure we've got the audio working properly. And this is what happened here. Sorry, I've got to, give me 1 second to get the sound working here.
You may have had to select the share sound when you started the slide deck up.
Thank you. I just heard some of that. I think, let me see if this is going to work now. Yeah, here we go. We've got it.
Okay, just lie down. Good.
Can you hear that?
Okay, how are you feeling now?
Yeah.
Good.
Yes.
A little tight in the ankles and calves? Okay. Lower back too. Okay, good. Anywhere else, or is that pretty much it? Put yourself into the state of self-hypnosis that we've done. Just take yourself to Hawaii, okay?
Now, notice I was not suggesting anything to him about this, but the tremor stopped. Whoops, let's go here. What's going on here? There we go.
Deep breath. Breath out, eyes relax, let your body float. Just enjoy the floating and picture yourself on the beach in Hawaii planning your activities. Feel the warmth of the sun penetrating into your body. And with each breath out, let a little more of the tension out so your muscles start to feel warm and loose. That's great. Each breath deeper and easier. Now, with your eyes closed and remaining in this state of concentration, please describe how you're feeling right now.
A little wet. Looking at what the sand.
A little wet, huh? The sand is wet. Okay, what else do you notice?
Kids are getting a little far.
Oh, you're getting nervous about the kids playing near the water, huh? Okay. And how's your body feeling?
Oh, warm.
Warm? Good. So you're feeling comfortable?
Well, it's hot.
It's hot, so you feel that hot sun. Good. Uh-huh. You're worried about getting a sunburn? All right, we better be careful. That's good. Okay. And so you're telling the kids to come closer?
No.
Good. Are they listening to you?
No.
No? All right. They never do. All right. Good. Keep your body floating. How do your legs feel now?
That's not sore anymore.
Good. Back's not sore anymore?
My quad is still tight.
Still tight?
My ankle's still tight.
All right, well, concentrate on the sun and the warmth in the back of your legs. And just let the tension melt away. Each breath deeper and easier, body floating. How are they feeling now?
My back's not sore anymore.
Muscles aren't sore anymore?
My back isn't like ankle will tighten.
Okay. All right, so
The calf is not.
good. All right, well, just let the warmth enter and let the tension drain away from your legs. Another deep breath. Each breath deeper and easier, body floating. So this is the exercise that you'll use in preparation for and during your MRI and during your surgery. Just go to Hawaii and enjoy what you can do there as you get your body warm, floating, and comfortable. Right now, we'll come out of the state of self-hypnosis together by counting backwards from 3 to 1. On 3, get ready. 2 with your eyelids closed, roll up your eyes, and 1 open. Ready? 3, 2, 1. Good. How are you feeling now, Brian?
Okay.
Okay? Does your body feel different from the way it did before?
My back will turn off.
Your back doesn't hurt anymore. Good.
The neck doesn't hurt.
Your neck doesn't.
No, it's slow. Salt, that's the eyes.
Little saltiness in your eye.
Yeah.
Think it's that salt water?
Yeah.
Okay. Anything else you notice?
No.
Okay. Good. Well, I think you're doing just great. And thanks for letting us take.
Okay. So I hope what happened there is clear. It surprised me because I was just trying to help him deal with his anxiety. But there is a feedback with many kinds of neurological, neuromuscular, and other illnesses where there is obviously a physiological problem, but at the same time, the way we react to that problem can either make it worse or better. And I think you could see that his tremor stopped just going into the state of self-hypnosis. And while he still had some tightness in his ankles and his legs, his back felt better. And part of it has to do with the snowball effect of stress and muscle tension and anxiety, where you notice something going wrong in your body, you start to get frustrated or anxious or worried about it. And then your body reacts to that tension by increasing its tension, and then you get upset about that, and it's like a snowball rolling downhill. But conversely, when he imagined himself going to Hawaii, being on the beach, watching his little girls playing in the ocean or on the sand, he got into that so intently that he was worried about getting a sunburn and felt salt in his eyes. And so that intense experience of something pleasant rather than unpleasant interrupted that cycle of stress and tension that exacerbated the problem he had rather than made it better. And there are people with multiple sclerosis that have the same kind of situation where they have some limitations in their ability to move, but they can walk around and get around. But then when they have to get on a bus, they suddenly freeze and they lose ability to utilize their neuromuscular connections such as they are. So I ask you to consider it as not one or the other, but both, that it's an interaction between brain and body that can either make things better or make things worse. And what hypnosis can help people do sometimes is make things better rather than worse, to reduce their sense of frustration and tension and help themselves make the most out of what the illness allows their bodies to do. So this is one example. And if there are, I'll stop if there are any questions or comments before we go ahead to talk about other examples. Any thoughts or feel free to just unmute yourself and say something.
Can you address what happened to Howie Mandel? You know, in America's Got Talent, he had he was a germaphobe, and I was surprised that he easily slipped into hypnosis when was easily hypnotized. I thought you had to be aware of it before, and that you couldn't be hypnotized unless you agreed to it. And they hypnotized him without him agreeing to it. Are you familiar what happened?
No, I'm not. You want to tell us briefly what happened?
So you're familiar with America's Got Talent, where you had
Yeah.
different acts. Okay, so a hypnotist came on America's Got Talent, and Howie Mandel is a comedian, but he's also a noted germaphobe and won't shake people's hands and gloves, wears gloves, and you know the usual. The hypnotist went on, did his act, but focused on Howie and hypnotized him, and he was able to shake the hands of his fellow judges on America's Got Talent. He was able to do things that he was not normally do. I mean, and his friends were saying, "Hey, give me a hug. Hey, shake my hand." And he didn't lose his mind over it because he was hypnotized. And then they brought him out of it, and he was what? He got pissed off about it later. Yeah. They brought him out of it and told him what had happened, and he was stunned because he had no memory of it, and he did get angry because he felt like it was a violation. Yeah. But so I was just curious what you thought about that.
That's a beautiful illustration of what I was saying. Now, I'll tell you, there are some people whose hands I won't shake either, but it's not because I'm a phobe. But it's exactly what I was talking about, that in hypnosis, you can try out being different. Now, I don't like the manipulation. I don't like, tricking him or doing something that he hadn't agreed to. But it does illustrate the point that he could suspend these long-held beliefs that he had, that he was going to be contaminated if he touched some stranger, and just try out being different and see what it was like. So I don't like stage hypnosis. I don't like tricking people, but it does illustrate the point that he was so focused on the task that he had been asked to do. He was so dissociated from his usual state of suspicion and worry about germs that he was able to let go of who he usually was and be someone different. So it's an extreme illustration. I don't like the way it was done, but I like the fact that it illustrates how dramatically people can change. And that's one example. If you think about it, the way in which we react to pain, to stress, a lot of things has to do with the complex pattern of brain activity that is helping us to perceive and understand what's going on and make decisions about how to act. And he is so used to viewing contact with a stranger, physical contact, as a danger, that his brain is preset to react that way. And he was able to just disconnect that circuit and try out being different and see what it felt like. And he was able to do it. So he was surprised, he was shocked. Later, he was angry. I understand that. But no, you don't necessarily have to get somebody's permission if they're hypnotizable. I mean, he clearly was. All hypnosis is really self-hypnosis. Not everyone is hypnotizable. With one exception, all 8-year-olds are in trances all the time. As you know, if you call them in for dinner, they don't hear you. Their work and play are all the same thing. But when we get to adulthood, our hypnotizability becomes as stable a trait as IQ. And about 80% of the adult population is at least somewhat hypnotizable, 20% very hypnotizable, about 60% somewhat, and there's about 20% who just aren't at all. So it's a stable trait, but if you've got the ability, you can use it. And sometimes people use it without realizing it. So like when I ask you, do you ever get so just lost in a movie or lost in a sunset, get so caught up? Do you get so caught up working that you miss an appointment or forget to go home for dinner or something? That's a hypnotic-like state. So hypnosis is not some weird thing that happens when a guy in a purple cape dangles a watch under your nose. It's a normal state of shift of attention that some people are more capable of than others. And so I totally believe that people in the audience were also hypnotized and also came out of it.
If you experience changes in a hypnotic state, how can you actually rewire the brain to maintain those changes, or what makes for lasting change experience in a hypnotic state?
It's like what somebody said when somebody, he asked somebody, how do I get to Carnegie Hall? And the guy said, practice, practice, practice. It is, yes. Neurons that fire together wire together. And you can retrain your brain to respond differently to stressful situations. And that's how it works for pain. We did one study, I don't know, I did one study, yeah, here, with women with metastatic breast cancer, who, it's a serious illness, it's progressive, they have pain, and the pain is particularly stressful because to many, is a reminder, they think that the disease is progressing. So every time they get a new pain in their chest, they think it means that the cancer is spreading. So it feels worse. So we taught them to do self-hypnosis at the end of each weekly support group meeting. We had them imagine they were floating in a warm bath, filter the hurt out of the pain, and how to handle the pain, how to view it not as an inevitable sign of disease progression, but as just another symptom they could manage. And what you see here is the results of the randomized trial. And the green line are the women in the support group who showed over the course of a year a slight decrease in their pain perception. The women in the control group had a doubling of pain over the course of the year on the same and very low amounts of medication. So by the end of the year, the treated patients had half the pain the control group did on the same and low amount of medication. So you can train your brain to respond differently to the same stimuli. And let's see, Anne McCarthy, you're quite hypnotizable because you totally focus on a book. That's exactly right. That ability to lose yourself in something is a skill and can be a very valuable skill. And we actually repeated this study in a new sample, and we found the same thing, that the women in the support group had significantly less pain by the end of the year than the control group. So the answer is yes, you can train your brain to make good use of it. So there are ways that hypnosis can help you put your body in a state of relaxation and dealing with anxiety. Sorry, I'm getting over a cold. In dealing with anxiety, you can start with your body and work your way up. Normally we'd think we have to calm ourselves from the head down, but it often works better the other way. So imagine your body is floating in a bath, a lake, a hot tub, or floating in space. Or imagine that you're somewhere else where you feel happier or more comfortable, like this gentleman going to Hawaii with his family. Change sensation. Imagine that part of your body is warm or cool, tingling, numbness, or distract yourself somewhere else. And those techniques can teach your brain how to view pain as a challenge, not a sentence, that you can learn to manage it better and help your body feel more comfortable. So you can interrupt that cycle of mental and physical tension that just makes things worse. And there's two ways of controlling pain. One from the bottom up. Pain is a signal that enters the brain through the lateral spinothalamic tract here and up to the somatosensory cortex. But it also can be controlled from the top down by the mental set that you have in relationship to the pain that you're experiencing. And here's one example. You can see that the baby here, Mary Dahlman, is getting the shot, but the father seems to be the one who's in pain. The baby looks kind of interested in it. So it's your mental set about the physical experience, not just the physical experience itself. In one study, randomized clinical trial, we published in the Lancet, leading British medical journal, we had 3 groups of patients randomized. They were undergoing intra-arterial catheterization to chemoembolize tumors in the liver, to deal with artery stenosis. And they were in 3 conditions: standard care, which meant they could push a button and get opioids, that plus a friendly nurse providing emotional support, and training in hypnosis. And what you see here is that by the end of 2.5 hours, the average pain scores in the self-hypnosis group were 1 out of 10. They were 4 out of 10 in the nursing support group and about 6 out of 10 in the standard care group. And here's the thing, the people in the standard care group were using twice as much opioids as the other groups. So they had half the opioid on board and had 1/6 the amount of pain that the people in the standard care group. This was their anxiety scores. And I was worried about the hypnosis group because they had absolutely no anxiety by about 2 hours. And I was afraid they died or something. They were just fine. It was 5 out of 10 for the standard care group and 3 out of 10 for the nursing support group. And the procedures got done 17 minutes quicker because not only were the patients more comfortable, but so was the treatment team because they didn't see the patients squirming and uncomfortable and anxious. And they had fewer complications by far in the hypnosis group compared to the other groups. And so we published this in the Lancet, leading medical journal, randomized trial. If that were a drug, every hospital in the country would be using it now. But it was hypnosis. People just can't believe that this could have that kind of effect. But I'm here to tell you that it does. We know more about what's happening in the brain. We took a bunch of Stanford students who are highly hypnotizable, hypnotized them, gave them shocks to the wrist. And you see that the red lines are the the evoked responses to pain signals here. The yellow line, same signals, but now they're hypnotized and told their hand is in circulating ice water, cool, tingling, and numb. And you see that this first component of the EEG just disappears within 1/10 of a second of the presentation of the signals, and the others are half as big. So the brain is very good at modulating pain perception if it's not an interesting or important thing to see. And this is a group at the University of Montreal did PET scans, shocking people, hypnotizing them. And if they said to them, you'll filter the hurt out of the pain, the way I mentioned before, they got analgesia, reducing activity in the posterior, the somatosensory cortex here in the brain. If you just said something different to them, they still got analgesia, but now if you said the pain's there, but it won't bother you, which is what people say on opioids, they also had analgesia, but now the change was in the anterior cingulate cortex, the same part involved with hypnosis. So you can control pain, changing activity in different parts of the brain. Lawrence is asking, do I consider meditation to be a form of self-hypnosis? Yes and no. It is an alteration in state of consciousness. Meditation also wants to get you to sort of de-emphasize the importance of yourself and what you're experiencing, but just be open to experience, let feelings flow through you, don't fight them, don't argue with them. You do a kind of body scan, which you can do in hypnosis, and you try to cultivate compassion in meditation, which is a good thing. But meditation is more a practice and less a tool. So it's a little more like taking vitamins, whereas hypnosis is more like taking aspirin. You're doing something to change a problem. So I'm not here talking to you to try and get a bunch of people in the world going out there and being hypnotized. I want you to use it, to learn to use it as a tool. So they're related, but they're not the same thing. Here's how they treat pain at UCSF. They get people to pay attention to something else. We're a little more sophisticated. This is just another example of mind-body control that we hypnotized a bunch of people first thing in the morning, had them eat imaginary meals, and we had a nasogastric tube down. And in hypnosis, eating imaginary meals, there was an 89% increase in their gastric acid secretion. When we then did the opposite, we said, be relaxed. Oh, and one woman halfway through, it was an hour each session, she was eating imaginary food, doing gastronomic tours of the Bay Area. After half an hour, she said, let's stop, I'm full. It was so vivid for her that she actually felt that her stomach was full. When we had them relax and imagine they were on a beach somewhere not involving food or drink, there was a 39% decrease in gastric acid secretion. And then we injected them with pentagastrin, which stimulates the stomach to secrete gastric acid. We still had a 19% decrease in gastric acid secretion. So the brain could regulate the secretion of gastric acid either direction. So the brain has a tremendous power to help people regulate how they feel. We also use it to help people do things that are very important for cancer, like stopping smoking. We don't focus on saying, no, don't smoke, you won't want to taste a cigarette, you'll reduce the urge. No, we say, think of being a good parent to your own body. For my body, smoking is a poison. I need my body to live. I owe my body respect and protection. You focus on what you're for, not what you're against. Hypnotists know better than to tell people, don't think about purple elephants. That's what you'll think about. Instead, you focus on what you're for. And we found doing that after a single session teaching people, this is face-to-face self-hypnosis, 52% stopped. Half of them did not touch a cigarette in 2 years. So we got 23% long-term abstinence, just one session of self-hypnosis. So it isn't everybody, but a substantial number of people, about the proportion who respond to medication, varenicline or bupropion or Nicorette, could stop smoking doing it. And I'll show you some examples from the Alexa app here. We found an increase in quit rate over 6 months, not a decrease as we saw in the face-to-face one, because people could listen to it time and again, and a decrease in average cigarette intake over time, even among the people who continued smoking. So it can work, it can help people. I thought what I'd like to do now, if you like, is have a little self-hypnosis experience. I don't want anybody who doesn't want to. Are you all on board for doing that? Yes, I don't hear any no's, but is there any
Lisa and I are saying yes. If anyone doesn't
Yes.
want to, they don't need
Yes.
to.
Yes,
yes? Okay,
yes.
good. I hear a lot of yeses. I haven't heard any no's yet. If you don't want to sit there and watch the rest of us.
Yes,
Yes, I'll do it. Yeah, for sure.
quickly.
Yeah.
Okay, quickly, you're desperate. Oh, okay. All right, so get as comfortable as you can.
Oh.
On one, do one thing, look up. On two, do two things. Slowly close your eyes and take a deep breath. And on three, do three things. Let the breath out, let your eyes relax, but keep them closed. And let your body float. Imagine you're floating somewhere safe and comfortable, like a bath, a lake, a hot tub, or just floating in space. And now please take your right hand and gently touch the back of your left middle fingertip. And then gently stroke down your finger along the back of your hand. And as you do, notice a sense of tingling and numbness and lightness. Continue floating past your wrist, along your forearm to your left elbow. And feel a sense of tingling and numbness and lightness, and let your left hand float up in the air like a balloon, all the way up, higher and higher. Each breath deeper and easier. Feel your body floating, safe and comfortable. Now I want you to inhale in a special way as your left hand floats up in the air. First, extend your belly and inhale through your nose. Diaphragmatic inhale, hold. Now expand your chest and fill your lungs completely, and then slowly exhale through your mouth. And once again, inhale through your nose, starting with your belly. Each breath deeper and easier, body floating. Inhale through your belly, then expand your chest and fill your lungs, and then slowly exhale through your mouth. Now notice how quickly and easily you can use your store of memories and your imagination to help yourself and your body feel better. Each breath deeper and easier. And now I'm going to give you this instruction about your left hand. Your hand will remain light and upright and in this upright position until I give you the signal for it to come down. You'll find that if you pull your left hand back down to the chair, the arm of the chair, it will float right back up to the upright position. You'll find something pleasant and amusing about this sensation. Later, when I ask you to touch your left elbow, your usual sensation and control will return. Right now, try pulling your left hand down with your right hand and then let go and see what happens. That's good. And now let go and see what happens. That's good. Right back up to the upright position. Imagine you're floating in a bath, a lake, a hot tub, or floating in space. And let that sense of floating loosen up your body. Allow yourself to just exhale stress and tension. Slow exhale. And feel a sense of warm, tingling numbness in your body. If you have any discomfort, just filter the hurt out of the pain. Each breath deeper and easier, and slow exhale. And now picture in your mind's eye an imaginary screen. It could be a movie screen or a TV screen or a piece of clear blue sky. And picture a pleasant scene, somewhere you enjoy being. Notice how quickly and easily you can use your store of memories in your imagination to help yourself and your body feel better. If there's something stressing you or causing you a problem, picture it on the screen, but with the rule that no matter what you see on the screen, you keep your body floating and comfortable. And then use the other side of the screen, the right side, as your brainstorming screen, to figure one thing you can do to deal with the problem on the left, but always with the rule that your body remains comfortable. And just feel the tension leaving your body, floating, warm, tingling numbness. Now, please take your right hand and touch your left elbow. So that you may notice that if your hand is still up in the air, it will float back down. And we'll come out of this state of self-hypnosis together by counting backwards from 3 to 1. On 3, you'll get ready. On 2, with your eyelids closed, roll up your eyes. 1, let your eyes open. Ready? 3, 2, 1. Okay, is everybody back with us here? I usually find after these exercises that people are not all that interested in talking. But if anybody has a reaction or a comment, I'll hear it.
What
Yes?
what did I do wrong? I mean, it didn't work for me, but my husband's cooking in the other room, so I could hear the noises of his cooking, which makes me wonder, how is Howie Mandel able to be hypnotized in a room full of noisy people? What did I do wrong?
You didn't do anything wrong. People differ in their ability to experience hypnosis, and some people are just not hypnotizable. It isn't everyone. So you just may be one of those people who isn't. Do you easily get caught up in movies or reading a novel or something?
It really depends on them.
Yeah.
It really depends. Sometimes if it's a good story, I can get pulled in.
But it's not easy. It's not always.
Yeah, it depends. It depends on this. If it's good writing, it's.
Yeah.
I can't say that.
But
I was with you about it. Yeah. Sorry.
I'll be right. Well, you see, the fact, Barbara, that you're, for you, it's a choice. If it's really good, maybe I can get into it, but others not. There are some people, I'm sure, for whom anytime they do it, they just lose themselves in it. They're not judging it, they're just experiencing it. So people differ in their ability. You didn't do anything wrong. You did what your brain is wired to do. Any other reactions? Any other similar or different reactions to it?
This is Steph. I've tried this several times using your app, and one of them being this morning to see how hypnotizable I am. And I'm kind of in the moderate level. Now, I did this just with you all, and the first time when I put my hand down, my hand did not come back up, but just now it did come back up. So, that hasn't happened to me until just now. And so I think that's very interesting. And, Barb, similarly, the first time I tried it, there was background noise and I didn't really feel very focused. And actually, when you had said, think about floating in a bathtub and all these different places, I couldn't pick which place I wanted to be in. So I was still so caught up on, whether I was in outer space or in the bathtub, that it really, the first time I did it, I was very sidetracked and still really thinking about where I was. And now
I
that
had that.
settle on one thing, it was really helpful, because I kind of knew what to expect this next time.
Mhm.
Choices.
We have the chat that says, can you speak about your eye roll technique?
Sure. So the eye roll is a technique that my late father, Herbert Spiegel, discovered. It used to be that you would look up to like a light on the ceiling and then close your eyes. And he noticed that people who were very hypnotizable had, all he could see was the whites of their eyes. They could keep their eyes way, way rolled up while they closed them. But then he had this really obsessional guy who was not even a little tiny bit hypnotizable. And he noticed that when he tried to look up, he lowered his eyes as he lowered his eyelids. It's hard to dissociate lowering the lid from lowering the eye. And it turned out that there seems to be a relationship between your capacity to keep your eyes up as you close them and hypnotizability. And a lot of the brain circuits that control eye movement also control level of arousal, and drugs that affect level of arousal affect eye movements. There's an old Zen practice called looking at the third eye, where you look up and close your eyes. So our eyes are part of our visual defense. It's our best sensory protection against threat. And to be able to look up and focus inward while you're closing your eyes seems to be associated with hypnotic ability. So it's not an actual test, it's a kind of indication, a quick indicator that you might likely be more hypnotizable. All right, any other questions or comments? Okay, so what I'd like to do in the last few minutes is talk a little about transformation, about disseminating hypnosis digitally. I've decided, I've used hypnosis with about 7,000 people in my career. That's a lot of people. I love helping people with hypnosis. But
Dr. Spiegel, I'm sorry to interrupt.
Yeah.
It looks like you're sharing your desktop maybe instead of.
Oh, sorry about that. Thank
I'm
you.
still sharing something
Right.
anyways.
Gotcha. Okay. Let me try it again. Thank you for that. Here we go. How's that? Got it now?
Yeah, got it. Thank you.
Thank you. So this was a piece that I published in Neuron about a month ago. And I thought, I can't do this forever. And I want people to be able to get the benefit of what we've learned about hypnosis. And so hypnosis is something that all hypnosis is really self-hypnosis. What I do is just teach people how to use the ability they have. So I thought there has to be a way to utilize modern technology to make it available widely to people. And so about 3 years ago, I was giving a Brain Body Summit talk at Stanford, and Ariel Poehler, who's the co-founder of Reveri, came up to me. He's a serial entrepreneur, MIT, Stanford Business School. And he said, you want me to help you build an app and see what happens? So Amazon was making it easily to program their digital interactive apps. We did it. We studied the effect on smoking. We built Reveri, and it's now easily available for people to learn to use to deal with problems like pain and smoking. And you can download it from the App Store or Google Play or on our website. You can get to it that way. And we have a whole bunch of problems people can deal with: eating, smoking, control, pain, stress, and the physical aspects of stress as well. Our brains have a tremendous capacity, but they don't come with a user's manual, and we don't necessarily use it as effectively as we can. So we currently have about, at any one moment, about 23,000 people are using the app. We've had 700,000 downloads since Reveri went online. And we're hoping that we can make this much more widely available for people to handle stress and pain, stop smoking. Our data are promising about how much it can help people deal with these kinds of problems. And we're in 109 130 countries now around the world. We're planning translations using AI into different languages as well. In one study of almost 16,000 users, we found that they could reduce their stress levels in just 10 minutes by about 20-25%. And so the nice thing is, right away whether it's likely to help you, as some of you had different experiences. But if it is, the majority of people, 8 out of 10, get some improvement in stress in 10 minutes, which is not bad. It's very useful for pain as well. We teach people to imagine this sense of tingling or going somewhere else. Be compassionate to your body. See how much you can manipulate the pain sensation. And for many people, it can be helpful. We found that on average, we got about a 25% reduction in pain over 3 months, just learning to use Reveri as their analgesic. And people said some interesting things. They like the fact that they're not just waiting for pain to go away, even if you take a pill. They like the idea they have agency. So, one of the things that scares people about hypnosis is losing control. Hypnosis is a way that can help you gain control, not lose it. You gain control over your mind and your body. And we've had some attention in the press. The Wall Street Journal had an article about Alexa hypnotizing people. For smoking control, we're finding that about 1 out of 4 people have stopped smoking a year after they're given the app to use, which is not bad. And people are, even if they keep smoking, they're reducing the number of cigarettes per day by more than half. And most of it happens in the first month. So it can be very effective to help people with habit problems like that. These are people, some of whom never even tried to quit before. And I love this one here. This woman's a social worker in San Francisco, and she said, I smoked for 25 years. I didn't even want to stop. My friends couldn't believe it. The first time I tried it, I didn't like it. The second time I lit up a cigarette, looked at it, said, who needs this? And I haven't smoked since. And she said, this is some crazy ass voodoo shit. And I mean that in a good way. So it's a way for people to surprise themselves, just like Howie Mandel did, to do things you didn't think you could do. And that is, she says it was like flipping a switch. People feel that they're just doing something different, and it's okay to try out being different. It's available. We welcome you to log on and give it a try. The first week is free. You can deregister if you don't find it helpful to you, but it can be a useful tool. And I think for Parkinson's in particular, it's not a cure for Parkinson's by any means, but it can help people deal with the understandable frustration and tension that comes with having the problem in neuromuscular coordination, and can help you at the least make yourself psychologically more comfortable and maybe physically more comfortable too, if you don't fight it, but instead find a way to help your body feel more comfortable and in less of a struggle. So hypnosis, we know what happens in the brain, specific regions that involve attention, your sort of alarm system, mind-body interaction, and your definition of who you are. You can affect a variety of systems in the body, including neuromuscular systems. You can modulate, you can reduce or even eliminate pain just by handling the pain differently mentally. You can manage stress better. And we know that it works not just face-to-face, but also using techniques like Reveri to take advantage of your own hypnotic ability. So mind matters. This is my daughter's depiction of what I did. My dad hypnotizes people and makes them want to live longer, and you see a particularly successful clinical example here. She made me promise that if I show this to you, I need to tell you that it does not represent her current level of artistic ability. And right now, she's an attorney working with Gavin Newsom to protect reproductive rights for women in California and around the country. So I want to acknowledge our funders, the National Cancer Institute, the National Institute on Aging, National Center for Complementary and Integrative Health, and National Institute of Mental Health, and California programs like the Breast Cancer Research Program, the Dana Foundation, and the MacArthur Foundation. And this guy is saying I was close to a breakthrough. He'd almost invented the wheel, but the grant money ran out. So thanks for your attention. That's the end of the formal talk. but I'd be glad if you have any questions or comments, I'd be glad to discuss them.
Yeah, thanks. Thank you so much, Dr. Spiegel. I did have one question, and then we are going to stop the recording, and then we'll just let everybody have a more open discussion. But one question in the chat says, did you say you had a book that might be for the layperson?
I don't have a book for the layperson. We have a textbook called Trance and Treatment. Bob used to be in charge of American Psychiatric Publishing, and it published the book Trance and Treatment, Clinical Uses of Hypnosis. You can get it from APA Publishing or on Amazon. There's another book about my late father's work called The Inner Source by Donald Connery, about hypnosis, The Inner Source. And so those two books could be helpful. If you're interested in a more professional way, Trance and Treatment might be the one to use.
Great, thank you. I also had one question, which is, I've actually tried out the app myself. And my question too is, for some people that may not have that high hypnotizability effect in the beginning, is there any benefit or just to listen to the recordings and kind of like just having this positive messaging? I mean, it seems like there's no harm in all the positive messaging, and most times people just feel relaxed whether they had their arm lifted or not. Can you comment about that?
That's a very astute question, and the answer is yes, because there are two components. The book is called Trance and Treatment, and part of it is shifting into the hypnotic state, and that may make it easier or faster. But the treatment involves a particular kind of positive emphasis strategy where you focus on what you're for, not on what you're against. You don't fight the pain. You don't fight cigarettes. You focus on respecting and protecting your body. One of our strategies on Reveri about pain is not altering the perception, but developing compassion for your body. If your 3-year-old kid were hurt or in pain, or frustrated and crying, what would you do? Would you get angry at them and frustrated? No. Your instinct is to soothe them, to calm them, to hug them and say, it'll be okay. And think of your body as your child. It's not your body's fault that you have this neuromuscular problem. So it's trying to cope with it as best it can. And you can help it by being sympathetic to it rather than angry or frustrated with it. And it's understandable why you'd get that way, but you want to focus on what you're for, respecting and protecting your body and helping your body to cope as well as it can with a difficult circumstance. And you'll find that you'll both get along a lot better that way. You and your body.
We're going to take one last question here. It says, can you speak about breathing practices for mental health and well-being?
Yes. We published a paper about a year ago in Cell Reports Medicine, in which we compared 2 breathing exercises, one of which I took you through in our little exercise called cyclic sighing, and another one, box breathing. Cyclic sighing is a particularly interesting, relaxing exercise in which you inhale. You want to inhale fully, so you start with, what actors and singers all do, abdominal inhale, and then expand your chest, fully fill your lungs, and then slow exhale. And the interesting thing is, we're sort of taught that the thing to do to calm down is take a deep breath. That's the instinctive thing everybody says. That's actually not the best thing to do, because when you reduce, you inhale by lowering pressure in the lungs, you expand your chest. You expand your lung cavity. That reduces blood return to the heart, because the veins don't have muscles in the walls, arteries do. And so when you lower the pressure inside your lungs, you're actually a bit reducing return of blood to the heart. And so the heart says, uh-oh, less blood coming in, I better pump more. So it stimulates autonomic arousal, increased sympathetic activity, increases heart rate. When you exhale, you're increasing pressure in your chest in order to exhale. You're increasing the blood that returns to the heart, and you're triggering the parasympathetic nervous system, the rest and digest nervous system, to calm you and slow down. And so what you do when you do cyclic sighing is you increase the amount of time that you're increasing blood return to the heart, and you're increasing parasympathetic activity. There's this thing called heart rate variability. The parasympathetic nervous system regulates this change in heart rate. And the more variability you have, the better off you are. And you need parasympathetic activity, for example, to go to sleep. So if you're having trouble going to sleep, try this exercise, because you will reduce your sympathetic arousal, increase parasympathetic activity. And it's something interesting, naturally pleasurable things we do, like singing, for example, is a form of cyclic sighing. You inhale quickly and slowly exhaling through your mouth. And so and we all have, sighing indicates acceptance. When you sigh, you may be accepting something sad, but the frame of mind you're usually in is okay. You just let it out. And that helps people relax. It's not fight or flight, it's rest and digest, and that helps you. The other exercise, and that we have training for that exercise on Reveri as well, the cyclic sighing. We also have box breathing, which is more tactical breathing. It's what the Navy SEALs do before they go out on a mission. You inhale, hold for an equal amount of time, exhale for an equal amount of time, and hold. So you're getting your body ready to act. So it's a more arousing, less relaxing kind of breathing. But we have the box breathing exercise also on Reveri.
This has been amazing.
Wonderful.
Thank you so much. Once again, I'm Steph, that's Lisa, we're PD-Connect. We teach exercise and education for people with Parkinson's. This is part of our speaker series, which is available on YouTube. So you can check that out for free. And Lisa,
We're just so honored to have such a world expert on this topic and the many applications that it can help with people with Parkinson's. So thank you so much, Dr. Spiegel.
thank you.
I'm gonna-